Welcome, everyone, to this episode of Manufacturing Talk Radio. I'm Tim Grady, and I'm here with the founder and host of Manufacturing Talk Radio, Mr. Lou Weiss. And joining us today is Nick Iacovella, who is the Senior Vice President for Public Affairs and Communications at a great organization called the Coalition for a Prosperous America. Nick, thanks for joining us.
Thank you guys for having me. I appreciate it.
Pleased to have you here. And because I don't know everything that CPA does, can you share with our viewers and listeners, what does the Coalition for a Prosperous America do?
Yeah, absolutely. So we're a bipartisan national trade association based in Washington, D.C. And our main purpose is to represent domestic manufacturers in D.C. With members of Congress, with the Biden administration, or whoever else may be president, at some point in the future. But the thing that makes us particularly, I think, exclusive is that all of our members have domestic production. So there's a lot of groups that operate in DC that claim to represent manufacturers and workers, and the companies are headquartered here, and they do all of their manufacturing overseas, likely in China or Southeast Asia. So what makes us unique, and I think what gives us a really good mission, is that we just represent the domestic manufacturers and the hardworking men and women that they employ. And those are the issues that we work on. So if we support something, we strongly believe that it's going to create good paying jobs in this country. We're going to boost domestic production in the manufacturing sector and other sectors that are critical to our economy. And so that's what we're doing every day. We're meeting with people on the Hill. We're meeting with the Biden administration, key officials, and trying to advance these causes.
So
Great.
That being said, with 10.8 million jobs open in the United States as of a few days ago, how are we handling that?
Well, are you talking about just manufacturing jobs, or just jobs in general?
It's a broad paint stroke.
Well, I think when COVID happened, that certainly, we lost a lot of jobs. And one of the things that, if you paid attention to what the White House has been saying recently, the president's created a lot of jobs. This is certainly true. I think it depends on your definition of created, not to get into too much detail, but we've basically recovered all those jobs that we lost during the pandemic, which is a great sign. We've had a resurgence of domestic manufacturing. And I think the pandemic really woke Congress up to the fact that we don't produce a lot of products in this country. Just things like PPE, for example, we learned pretty quick in the pandemic that, we don't make a lot of those, and they're necessary. And in times of crisis, that's when we really feel the pain of having offshored that production. But there's still a lot of jobs out there that need to be filled. The chairman of our of CPA, he has a tool and die company. When I talk with him, he'd like to expand. He has very high quality job positions that are open. They make incredible products, including stuff for the F-35, which, if you think about, that's our most awesome, fighter that the U.S. government and military are operating. And it's awesome that we have a great American company, making components for the F-35. And they do plenty of other stuff too, but that's just one example. We have a lot of good jobs that we can fill. I think it starts with education. Too many people today are locked into, I need to go to high school, I need to get a 4-year college degree, I need to get a master's degree, I have to go to law school, I have to become a doctor to have a good career, support a family, save money for retirement, send your kids to school, maybe take a nice vacation at least once a year. That's not necessarily true. Certainly there's plenty of Americans that have taken that path. But, somebody that has a high school degree, or went into the trades and works a manufacturing job, I mean, these are really high quality jobs. And, if you go around the country, I was listening to JD Vance the other day talk about where he's from, Iacovella, and the area he represents in Ohio. We used to have hundreds of thousands of those kinds of jobs in that part of the country, and plenty of other communities too. And when we offshored them, that community was really hit hard. But those people working in those factories, they supported their family. They were able to send their kids, to college or wherever else they needed to go to build a good life, and they were manufacturing workers. So I think it really starts with the education level and letting people know that there's these opportunities out there and they're important, and we need to keep bringing production back to create more opportunities just like that.
We had a gentleman on our show yesterday from the 601 welder union in Wisconsin,
Oh, awesome.
who talked about a lot of what you're now talking about, and the fact that the apprentice program, after 5 years, you can really make a lot of money. And I threw in what I know about it, because these hands don't do a lot of that stuff. But the bottom line is that, take, for example, an underwater welder can earn $150,000 a year income, plus pension, plus this, plus. And he doesn't have a $200,000 college debt. So
Yeah, absolutely.
So there's a lot of things that I think that parents need to be taught and shown about what they could do for their kids without raising a huge debt, and give their kids a good, viable life.
Yeah, that's a great point. And that's something I didn't mention, but there's so many students today graduating with tens of thousands or even hundreds of thousands of dollars in debt. And there's been some talk at the federal level about forgiving some of that debt. And there's a lot of questions about the fairness of that. But I think even just bringing ourselves above and looking at the problem, if you're coming out of school with that level of debt and you're not getting a high quality, high wage job, you're going to have a tough time starting out in your early 20s, maybe late 20s, even into your early 30s, whereas a job like an underwater welder, which, we actually know a family friend who does that. He does incredible. And, he loves his job. He makes a great living, and he never has any debt from school, and he's been doing it for quite some time. He's got a great pension and benefits, and he's part of a union, which, really supports him, and they do a lot of great work. I think I didn't mention this, but there's really a role for the unions in this too. I think sometimes too much like partisan politics gets caught up with, whether people like unions or not, but they do a great job. And I think we really need to leverage them to continue educating not just parents, but young people about what these kinds of jobs are, what they'll be doing, what the pay is, what kind of life they could have. So that's something I think is really important too.
Nick, I know when you and I spoke on the phone, I was impressed to hear that the Coalition for a Prosperous America is involved in things like reshoring, bringing pharmaceuticals production back to this country, because God forbid we have another pandemic event and we can't get what we need because we don't make it here. China buying up American farmland, and other countries as well. All those kinds of events that could become very adverse in what is becoming a particularly frayed world. I just want to mention that so that our listeners understand a bit more of what CPA addresses.
Yeah, I didn't really get into our industries, but we represent, a very wide swath of industries in the U.S. economy, and pharmaceuticals is one, renewables, steel pipe, I mentioned tool and die, plastic molding, textiles. I mean, the list goes on and on and on. And the pharmaceuticals, I think, really post-pandemic, what we've seen in the last year, which has been incredibly encouraging, is lots of members of Congress are talking about this on both sides of the aisle. And, I always joke, I used to work for Senator Marco Rubio, and when you have Marco Rubio and Elizabeth Warren, saying publicly that something's a problem, most people know they're not ideologically on the same line. But they do work very well together in the Senate, despite what some people may see on TV and things like that. They've partnered together on some really, great pieces of legislation. And when you have folks like that agreeing that something's a problem, that just lets you know that this isn't really an issue that lawmakers are viewing from a partisan lens. It's not a Republican or a Democrat issue. It's just a crisis that we need to fix. And we've been working really around the clock this year on some legislation that would really help to reshore a lot of these supply chains and boost domestic production of generic drugs, which most people are familiar with, your brand name drugs and how much those drug companies make. They're ginormous, how much they charge, for prescription. But what they're not familiar with is our generic drug supply, which is the issue that we're working on. So it's totally separate from the brand name drugs. Generics account for 90% of prescriptions dispensed in this country. So if you're taking a drug, there's a great chance it's a generic. And, you probably have, it's definitely a lot cheaper than the brand name. But it's not just a drug shortage problem. It's also the safety and the quality of these drugs. 1 in 4 prescriptions is coming from a foreign manufacturer that the FDA has cited as non-compliant, which means they've given them a warning letter or Form 483. That's technical speak for really bad manufacturing practices. And the FDA actually characterizes that as significant violations of FDA regulations. Just one example, Lupin Pharmaceuticals is an Indian multinational generic pharmaceutical manufacturer. They've received, warning letters recently. The number one leading cause of death among Americans is heart disease. And one of the medications you take for that is lisinopril. It's fairly common. If you talk to your doctor, they know exactly what it is. According to industry data, Lupin has 85% of the market in the US just for lisinopril. And they've been dinged by the FDA for violating good manufacturing practices. They've had multiple warning letters, recalls. So we don't want to be dependent on these bad actor companies overseas. So it's even bigger than the drug shortage problem. And, that's something we're really working to educate people on. Definitely members of Congress. It's a big issue. You have to start somewhere. If you look at it as a whole, it looks almost insurmountable, but we have to start, making some of these products here and at least addressing some that are on shortage currently.
Nick, you brought up a story that just happened to me yesterday. So it's a 2-minute story. There's a particular medication that I take, and I've been taking it for 10 years. And somebody told me at the drugstore, why don't you take the generic? I said, oh, I didn't know it has a generic. So, well, they told me the whole story, and the brand is $678 every 2 months. I said, oh, okay. How much is the generic? Oh, $678 every 2 months. Well, why am I taking a generic versus the brand? Well, that you'll have to take up with your insurance company. That's the other racket that exists. So
yeah, you're exactly right.
Insulting any insurance company, I hope that you're pissed at me.
Yeah, there's actually, we call them middlemen. They're called pharmacy benefit managers, and they're a huge part of the problem. And
You bet.
the Senate just had a hearing on this a few weeks ago, and the PBMs were, they love to say that they get discounts for consumers. And, when the senators dug in on this, they said, well, we see that you're getting a discount from the manufacturer when you purchase a large quantity of the medicine, but you're selling it for an exponentially increased value, into the US healthcare market. So where exactly is a discount benefiting the American patient, the consumer? And they don't have a good answer for that. And the reason why is they love foreign manufacturers, because manufacturers in China and India, they're subsidized by their state governments, so they can afford to take a loss every year. It turns out that, to make drugs in a high quality way is expensive. Our own members will tell you that. It's why they've invested literally hundreds of millions of dollars in this country to manufacture drugs, not just to the FDA standard, but to the highest possible standard that they can. And overseas, it's different. Some of the warning letters that I've read, if your doctor told you, I'm going to put you on this generic, it's coming from a facility in India called Dr. Reddy's. And by the way, they had a warning letter for bacteria and microbial contamination. And, they didn't have some testing, and they actually falsified a lot of their tests. But anyway, it's cheap. So I'm going to give it to you.
Drug.
You're not going to tell them, oh yeah, doc, absolutely, give me that one. You're going to say, wait a minute. But the problem is most doctors, they don't have that information. We work with a great doctor from the Cleveland Clinic. He was a cardiologist for years, incredibly smart guy. He's very passionate about ensuring that Americans have access to safe, affordable, quality medicine. He told us a story there. He had a heart transplant patient. So, literally cuts the heart out, puts a new one in. You take a drug called tacrolimus when you're a transplant patient so that your body doesn't reject the new organ. So you can imagine, for somebody getting a heart transplant, having tacrolimus that works is incredibly important. So his patient was doing great. Then a few years later, our doctor that advised us, he retired. His patient calls him and says, I've been having a lot of health issues. And, they said, I need a new transplant. And this is a serious problem. So he said, let me look into this. He found out that they changed the manufacturer of the tacrolimus to a one in India. It wasn't dissolving properly, so the drug wasn't working. Just imagine how many times this is happening in this country. Thankfully, they found out, they put him back on the original manufacturer. He's healthy now, the patient. He doesn't need a second heart transplant, but there's always a conversation about cost to the healthcare system. Brand name drugs cost so much, a surgery costs so much. We don't actually know what the remittance rate is for bad drugs from overseas manufacturers that are causing patients to have to be remitted to the hospital. But even just a conservative estimate is that this is in the billions of dollars a year that's costing our healthcare system, because Americans are taking bad generic drugs from foreign manufacturers that have demonstrated a repeated pattern of violating FDA regulations. And so that's just another piece of this, problem that we work on and, try to educate members of Congress about.
Nick, you're with the Coalition for Prosperous America. You just laid out a very serious problem that we all know different degrees of. And I just laid out my own personal story a moment ago. Do we have a solution? Do we have an idea of what the solution is? Does the Coalition of Prosperous America, does the Congress, the senators, the congressmen, the farmers, do they have a solution, or are we just stuck with where we are?
So I'll say, for everybody listening, the bad news is it's a serious problem. The good news is we do have solutions. It's more than one, and we're working to actually get these signed into law this year. So I like to think about it really in three different buckets. The first is that the FDA as an organization just really needs to be reformed from the inside out. Congress needs to actually hold this agency accountable. There's no reason that we should continue to reward bad actor foreign manufacturers that continue to demonstrate, bad manufacturing practices. And so we have legislation that would actually mandate that the FDA, begin to actually do their job and conduct an oversight. But the FDA is between a rock and a hard place. If all of our supply is coming from bad manufacturers and the FDA shuts them down, we have no supply at all. And they'll tell us that that's why we can't cut off supply from these manufacturers, even though they continue to just do bad things. But that's really not an acceptable answer. And so that's why bucket number 2 is to increase domestic manufacturing of generic drugs in this country. And that really takes a mixture of different policies, but most importantly is we're working on a tax credit legislation for companies to actually produce products here. So if you're a domestic producer of generic drugs, then you'll get a tax credit in order to boost supply, or if you want to make a capital expenditure to invest in new facilities in this country, new productive capacity, there'll be a tax credit there. We've already seen how successful this is in other industries. Most recently in the Inflation Reduction Act, there was a huge package in there for renewable energy. This is batteries, solar, wind. Literally tens of billions of dollars have been announced in new investment in this country to expand capacity. And I like to tell people, I tell my friends who are Democrats, if saving the planet and, going green is that important to you, I hope you would agree that our nation's supply of drugs is at least as important, that we should be doing the same thing. And the argument for my Republican friends is that we're dependent on foreign adversaries like China, for these products. And in times of crisis, we need to have a supply here. And thankfully, a lot of them are kind of ditching the old Republican ways of, let's let the free market decide. And, I was a finance major in college. I took economics. It's nice in the classroom. It doesn't work in the real world. When China and India are subsidizing their own state, champions at the expense of ours, we have to take some action. It's too critical of a sector, for us to just stand by. So, and then we need the federal government, DOD, wholly dependent on China for medicine. Let's get some real Buy America solutions in place that if it's domestically available, the federal government needs to buy from a domestic producer. And I say, Buy America kind of loosely because our current Buy America standards have so many loopholes. It really means, Buy America or 47 other countries. And that's just not, it's not the intent of the law, at least in my mind. And I would think most Americans would agree. If the federal government's going to buy American, it should actually be a company that manufactures, on American soil, not in another country. So that's what we're working on. It's a huge effort, but it's good for the country. We can't afford to fail on it.
We would like to help you out in that mission. When you and I talked on the phone, I would love to have any articles you want to submit to our Manufacturing Outlook easing to help publish the content that you're producing to get the word out. We're tight on time. I really appreciate you being with us. And clearly, we're going to have you back on another show. Thanks for joining us.
Yeah, I'll be looking forward to it. Thank you guys for having me.
Thank you, Nick. And I'm not sure we came up with a solution, but it sounds like the direction that we have to go.
Yeah, that's right. We're working.
You sound like you are. And what you learned in college was that you need to be doing a lot more in terms of finding ways to find a solution. College doesn't give it to you.
Yeah, that's absolutely right.
Thanks a lot for being with us. We'll talk to you. Tim, thank you very much. Be well.
Thank you both.
Bye for now.